Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
This is a special episode in light of some of the movement taking place in Washington. We're recording this on Friday, the day after the conclusion of a set of hearings for HHS nominee Robert Kennedy Jr. So it was a pretty big set of hearings that we thought we should recap before the end of the week and get it out there.
Yeah, maybe we can start with what exactly is the role of the head of HHS, and also what are these hearings about?
Excellent question. So under the Constitution, we have several roles that are appointed by the president with the quote advice and consent of the Senate, which has come to mean an actual vote of senators equaling 50% plus one. This is a role that he has been nominated by President Trump to lead the Department of Health and Human Services, an agency that manages a $1.8 trillion budget, an agency that shapes policies that directly impact the health of all of us, an agency that underneath it has many sub-agencies that we are familiar with, agencies such as the Food and Drug Administration, the FDA, agencies such as the NIH, which deals in research, the CDC, which helps contain disease outbreaks, of course. And also notable is that HHS really acts as the liaison between the federal government and state and local health authorities. But perhaps most notable is the Secretary of HHS is essentially the top public health officer in the United States. It's a very high profile and visible position from which to promulgate theories and ideas on public health.
Yeah, so we can see how this impacts our community, who are people who live with chronic disease, very concerned with health. This is going to be the key public health leader overseeing these agencies, which ultimately have decisions and influence on how healthcare is received and accessed in this country. So, Stephen, why don't you break down some of the main points that you got after listening to the hearing?
Yeah, so let's get into it. We'll keep it quick, but essentially it was an important week. It was two hearings, actually, one on Wednesday, one on Thursday. Without getting into the specifics, the hearing on Wednesday was with the Senate Finance Committee, and that will be the committee that ultimately decides whether or not to vote him out to the full Senate for a vote. So it was technically two separate hearings, but I guess you could think of it as one extended hearing. With that, there were a few takeaways. Overarching, it was very obvious that he did not have any support on the Democratic side. Democrats came out pretty strong. Most of the questions focused on vaccines because this is RFK's most controversial and historic stance. We got glimpses of other topics such as Medicaid and a fair amount dealing with abortion as well. I did not hear much about chronic disease or things of that nature. But again, I would say the overarching was on vaccines with secondary topics being Medicaid and abortion. So just to get into it, some takeaways. So the first is, there were a few questions about the organization of HHS and the health ecosystem generally. He fumbled a few times. He confused Medicaid and Medicare multiple times. He did not have an understanding of EMTALA, which is the Emergency Medical Treatment and Labor Act. It's an important act that essentially says that you cannot be denied emergency services, or I guess you could say in the affirmative, it requires health institutions to provide you with services regardless of your ability to pay. He clearly struggled to understand the differences between Medicare Parts A, B, and C. So we'll see how he goes from there. There was a more positive, which we'll come back to, I would say, from the perspective of patients. That was sort of the overview when it came to HHS itself and the health ecosystem. When it came to the question of science, because this is someone who has, shall we say, questioned science a lot in the past, just on a personal level, and I would say on behalf of GHLF, I think I'm allowed to say this. This was perhaps one of the more troubling aspects. A quote that I saw that he said, I think multiple times, is, "I will look at the evidence before I make up my mind," which on face value sounds very reasonable. You want to look at the science, right? You want to look at data, right, before you make a decision. The problem is the science is very clear on many of the issues that he was questioned about, and he just ignores that, and he comes back with this, I'm going to look at the evidence. I'm going to look at the evidence. All right, so specifically when dealing with the issue of data, this is where vaccines came into play, and vaccines and autism. Even though large-scale studies over and over and over show no link between vaccines and autism, RFK Jr. cited a non-peer-reviewed blog as evidence of a potential connection, and this was something he did not back down on in the hearing. In terms of safety, he questioned the safety of vaccines that are currently approved, again saying, I need to see the data, I want to see the data. These are, again, things that are already out in the world where the safety and efficacy has already been proven. If not proven enough in the labs, certainly proven enough now that it's in the real world. He also had issues dealing with some financial conflicts of interests. He has a stake in a vaccine-related lawsuit specifically, which you would think would pose a conflict of interest. His stake is in the accusation of issues regarding the vaccines and harms that may come from it. And he refuses to withdraw himself from the vaccine. So he has a personal financial stake in an outcome of something. And as HHS Secretary can push forth information and data that would help his own personal financial case. All right. I have to say, my favorite moment of the hearing, I have to tell you, on Wednesday was when Senator Bernie Sanders confronted him with a photo of a baby onesie that he was selling on his organization's website. The onesie says, "Unvaxxed and unafraid," and another one says, "No vax, no problem." RFK Jr. refused to answer whether he agreed with the sentiment of those particular onesies. He called himself pro-vaccine, but again, he was also selling these onesies for $26, I found out, according to Bernie Sanders' is questioning. We'll say there were definitely some issues there. He did say some things that I think are, if not patient-friendly, more public health-friendly. He supports PEPFAR, which is the President's Emergency Plan for AIDS Relief in Africa, although in the past he has said that HIV doesn't cause AIDS. But that being said, a support for PEPFAR is something that, if you support public health, is something that you should support. He also said that he supports medication-assisted treatment for substance abuse disorder, but this is a stance that is in opposite of past statements he's made, but he seems to have come around on that. He also said that he wants to invest in bird flu vaccines. However, he would not commit to investing in mRNA vaccines. Once again, saying I need to look at the data. But mRNA vaccines, as we all know, worked very well and are continuing to work very well when it comes to COVID, but he hedged on investments in those for future outbreaks such as bird flu. He said that he supports the polio vaccine and he would not change its recommendation for usage in the United States. And just to end on a very positive note, I think that Senator Chuck Grassley of Iowa asked him specifically about the importance of lowering drug prescription prices and holding pharmacy benefit managers, PBMs, accountable. And in response, Kennedy said that he agrees with those provisions. So that was good to hear. And most notably, Senator Grassley is somebody that GHLF members have targeted. We've visited with Senator Grassley in Washington and in Iowa over the past several months, several years. So to see a question like that get out in an open hearing like this, and to get the potential HHS Secretary affirmatively on record under oath agreeing that pharmacy benefit managers should be held accountable for drug prices is a very good thing.
Yeah, thanks for that recap, Stephen. Like you mentioned, some of the views around vaccines are concerning. I'm glad you ended on that positive of we need more PBM transparency and reform. So I guess I'm a little hopeful and we'll wait to see what's to come. So what happens next is my question. We had these hearings, we found all this out. What's now?
Good question. So now the Finance Committee is going to vote for him to go to the entire Senate, or they'll stop his nomination altogether. I think based upon what we saw, it's a strong likelihood that he will go and get that full vote before the entire Senate. The full Senate vote has not been scheduled as of our recording. We're recording on Friday, but it will probably be very fast. This used to take many, many weeks between going from a committee to a full vote. 4 years ago on Biden's nominees, it was about a month on average, the committee and full votes, but I think there's a very good chance the vote could come next week. Things are moving at lightning speed in Washington all around. We've already got, I think, 2, maybe more, at least 2 members of the cabinet have gone through very quickly, Pete Hegseth and Kristi Noem. It looks like the way things are pacing in Washington, it'll probably come for a vote next week, if not the week after. And it looks like every Democrat will probably vote against him. However, he's got a few buffers of votes on the Republican side, and it doesn't appear as though any Republicans seem to be voting no, and he could still escape by it with a few no votes anyway.
All right, so I guess it's good. If he's gonna get him in sooner, and get the work started. I guess perhaps by next recording.
Depending on what the work is.
Depending on what the work is. I guess perhaps by next recording we'll have an update for our audience.
Well, before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news a week to help you make sense of it all. If you liked this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.